let's jump into it. So everybody who's on the call is also looking at a screen as well, right?
Right.
Okay.
Yes.
So we've got the agenda up, and that's the same as what we put out in email earlier in the week. So our hope is that we can spend a little bit of time just reorienting ourselves to the roadmap. And I can give you a few reminders about some of the new items that you'll see there. And then we'll spend the bulk of the call talking about some of the priorities for goal 1 and goal 2. And then we'll spend the last 10 minutes talking through some of the next steps to get us to having a set of projects funded by the end of this year. And our challenge in all of this is that we have so much ground we might want to cover, but we really only have 2 hours. So Caroline is going to be our master timekeeper. She's got a really big hook, and she's going to help keep us on track.
We'll visually and audibly tell you when we have to move on to the next item, and it's not to cut anybody off. We just know that what we're trying to achieve in the next 2 hours is a very big task, and so we're trying to keep on task as much as we can, knowing there may be some conversations that we're going to have to, put on the whiteboard and deal with after the call. So when you see this very friendly-looking clock, just take it in a positive way that, okay, I get an opportunity to talk about the next thing.
And we realize there will be a lot of conversation after this meeting as well. So this is not the only opportunity to raise a concern or a priority. This is continuing the conversations that we've been having. So meeting objectives.
And just before the start, I do want to say that what you guys have put together is a fantastic document, and it was probably a ton of work to do. So I think that's our, so you did a lot of work ahead of time, so we might be able to pull this off.
Thank you.
Thank you.
And so just one more reminder that we also put in the email is we really don't expect to walk away from this meeting saying we're going to fund projects A, B, and C. And we've definitely heard loud and clear the concerns that people had when we funded the year 1 projects, that we don't want to be just meshing ideas together. But right now the ideas that are in the roadmap are still somewhat fluid, we feel, and this is a really good opportunity to go through them collectively and think about where there might be opportunities for a little bit more collaboration. Maybe there's a project that has a huge scope and we need to give it a little bit more direction early on before we define certain pieces that might be worth pursuing with year 2 funds. And so we really just want to have this conversation about those bigger priorities and starting to think through what's most important to be moving forward into year 2, and other ones that we might be thinking about just as part of the longer time frame. And then we'll keep pushing all of these ideas into the next phase. So the next slide, yes, this is just something that we thought would be helpful for everybody to keep thinking about. These are maybe 5 of the most important considerations for thinking about all the project ideas that are in the roadmap now. We certainly want to take advantage of the quick start projects that have already been funded, what we learned from those, what literature reviews were conducted, how do we build upon those so that we're not just necessarily starting from scratch. At the same time, we realize there will be new projects that we want to take on that weren't covered in year 1, and not all year 1 projects will be easily, perfectly extended into the next year. But we want to keep that in mind and also remind ourselves about what are the biggest areas where we have the potential to reach those goals and objectives that we've set into the roadmap. Since we've had so many conversations now about those goals and the objectives, now is a time to reflect upon the activities that are in there and how they will help us meet that. And as we mentioned, where is that coordination or collaboration opportunity? And then I think, all of this conversation is still within the framework of our budget. So David, did you want to add anything to that point?
Yeah, so as you guys know, you've all submitted year 2 budgets. And just like last year with the first year budgets, we tried to work very carefully with you to make sure that what projects you were doing fit within the budgets that you had available. And those would be budgets that you were assigning for purposes of research projects versus budgets you were assigning for education and professional development activities. And so kind of keep all of that in mind. We're cognizant of that fact as well, that we have whatever projects we end up choosing and whatever activities we end up selecting, we know they have to fit within the budget that you have available. And so obviously, you know, we can't all be involved in 15 different activities. We have to kind of pick and choose how we're going to work together and what things we're going to team on. So we'll kind of keep that in mind as well.
Mm-hmm. And just also keep in mind that we're only talking today about goals 1 and 2, and goal 3 is going to come later, and that's the one most related to the educational tasks, which will have its own kind of budget. So, you know, we have to always set some amount aside for that.
It looks like Steve and Noreen are both on too. So welcome, Steve and Noreen. Steve, we can see you too. And
Can't hear you.
Can't hear you. Can't hear you then.
And what's more, I figured out how to use the unmute button.
Nice.
Okay.
And just want to get, Eric, you're not on, right?
No, I'm here now. I figured it out.
Okay, great.
Yeah. I'm in Auckland Airport, and when my colleagues arrive, I'll have to hop off the call. But I just checked the flight. I don't think they're due for another hour and a half.
Awesome. We'll be done by then. All right.
So really quickly, we're not here to revisit or wordsmith the mission or vision right now, but I did want to go ahead and devote one slide to it. This is kind of where we landed with the language that you'll see on page 7 of the roadmap. I think this was really a group effort to come up with the words that we've used here. And you know, maybe not in this call, but if you have any other feedback on this, we would really like to hear your thoughts. But we'll go ahead now and just jump right into the goals. So the goals, as you know, as we've had conversations about, we now have 3 overarching goals. And in this latest version, you'll see that each goal now has 4 objectives. And so what we've tried to do with these tables is show the 4 objectives, and then what the projects that we funded in year 1, how those might be distributed across them, and then just start to have a placeholder for thinking about all the project activities that are in the roadmap now, how any of those might fit into year 2 or year 3 or beyond. So everything past year 1 is a question mark. It's open for discussion. But I think having this table helps us see where we have clear gaps. So you can see in year 1, we focused a lot on, we focused some on learning a little bit more about safe systems approaches through projects R1 and R3. And then we have some kind of ongoing training and professional development to help us think through safe systems. While some of that work was funded, not all of it has even gotten fully off the ground yet. Some of the seminars are still being planned on safe systems. And we certainly didn't get in year 1 to the point where we felt comfortable bringing in states and cities in that objective 1.4. So we know that that's a gap. And I think an open question is how much in year 2 we might start in that area, or if we're still really focusing a lot on some of the other objectives in goal 1. So we'll come back to that when we start having that conversation. Goal 2, oh, and just one more comment about goal 1 and goal 2, if you want to jump back. This was something that Steve and Noreen were really helpful in making a a more clear distinction between these goals, because at one point there was a question mark, well, is this one more about research and this one more about professional development? And I think it didn't really cut that way, but the way that we're trying to understand goal 1 is that it's really about the definitional research that'll help us define safe systems, what a safe system approach looks like in different contexts, what are those bigger components, and then how do we start engaging those stakeholders, states and cities and others, to think about the overall safe systems approach. Whereas goal 2, if you want to flip to that, is a little bit more about the nuts and bolts, the individual components and research that might either inform or help make up a bigger safe systems approach. So a lot of this research, the work that we were doing in year 1, for example, offers project looking at a systemic analysis approach. It's very compatible with safe systems thinking, but it's a smaller component. And so that's where we felt like that research really fit in, was actually more of this goal 2. And in the future, we want to continue developing cutting edge research and creating new data sets and tools that may not address every element in a safe systems approach, but could be used in it. So that's kind of the distinction we're making between goal 1 and 2. And then goal 3, we're not going to cover a lot here today. That was on the education of future leaders. So another piece that we added to the roadmap is on page 5. That's where we really wanted to keep at the front of our minds some of the biggest issues that we are facing in the traffic safety world. And remember, when we're thinking about projects that we're funding, remember the types of crashes and the types of issues that our research and our programs could help address, and think about how we could be making sure to orient those to where they have the biggest potential impact as well. So we just included a little snapshot there from NHTSA. I don't know, David, did you want to say anything else about that slide?
No, I think one of the things when Laura and I talked about this, and the reason we thought it was important to include this is ultimately our success is not going to be, at the end of 5 years, it's not going to be measured by how some of these numbers change necessarily. But it's important for us to keep in mind that what you see on this list are the most prominent problems that we know exist. These are enduring problems that we know exist, and we need to make sure that we're addressing those, because if we are going to have an impact in terms of what we're doing with trying to implement this new approach, this is what we need to focus on, because this is where we are going to have the biggest impact in road safety. And so I think it's always important to keep this in the back of our minds, or in the front of our minds, as to these are the types of problems that we really, really need to focus on. And you've seen just recently, pedestrian crashes in particular have taken another jump again this past year. In 2016, I guess it was. I just saw some numbers come out. And so I think all of these things are things that we want to make sure we're addressing, because this is where we're going to have the impact long term.
We decided not to hard code the issues into the roadmap to have like a specific objective focusing on a certain issue or a certain user. We felt like that might not give us the flexibility needed to think outside the box if we were still thinking about, one specific mode or one specific problem. But I think we do, like David said, we just want to keep those issues in mind. And once we have gone down the road in selecting projects, go back again and see, how might those projects really help us address the issues, or maybe the other emerging issues that we're expecting. So I just had one last slide on potential gaps. These were just my observations in compiling all the ideas into the roadmap. It seemed that a lot of the year 2 ideas we're very heavy on the research side and still light on, translating the research findings into programs and tools for adoption, getting those tools implemented. I think in some ways that makes sense because we have to have a lot of research developed before we can start getting it out there. But at the same time, we also know that there's a lot already known on certain issues, and there's a lot of good existing resources. There may still be other professional development opportunities that we need to be thinking about sooner rather than later. The other thing that we noticed was that there was a really good focus on the issue of speed, and we saw at least 3 projects looking at the role of transit. Another group of projects were bringing in kind of the planning component, thinking about the relationship of planning and community design to safety. But we still had some gaps. Impairment in particular is one that if you flip back to that slide, it's, I think, the number one issue in terms of economic cost out of, I get number 2 after speeding. But we didn't have a single project that was really specifically looking at the issue of impairment. So that's another thing just to keep in mind is, are there really important issues that we're not addressing now? And if so, that might be something to address in the future. Do we have a couple minutes for questions? Yeah, we do. Are there any other observations kind of at that higher level about gaps that you saw or holes that we really need to think about filling?
Asad here. Yes, I think there are some. If we go back to the slide that you had for the different dollar numbers, please. I don't think we have anything on motorcycles. We have vulnerable road users, but motorcycles is a gap, I think. And also, I think we are not proposing any projects on seatbelt use or non-use and helmet. So these are, I think, gaps that we need to fill through projects.
And again, we may not fill them all in year 1, or I guess we're in year 2 now. But we need to make sure that those things are addressed at some point in our roadmap if those are the key priorities for the center.
Laura, this is Steve, can I have a follow-up comment to Asad's comment?
Mm-hmm.
It's supposed to be a systems approach to these issues. So the problem we're trying to address is not seatbelt use or lack of helmet legislation. The problem is, why do we have those things? So we shouldn't be trying to plug these gaps as if they were holes in a dike. We should be looking at the infrastructure of the dike, of the system. So I don't feel that we need projects that address all of these topics one by one by one. What we need is a bigger picture approach to these things.
Good point, Steve.
And this is Eric. One thing I would follow up on that we're missing is particularly vulnerable populations. So we've got older folks in there, but we don't have lower income, lower SES who are disproportionately likely to be injured or killed. And one thing that I emailed Noreen and Tab about this, I'm working with a colleague here. One thing to look at is the environments that these folks are located into, because I think we're going to see that there's environmental causes that are putting these folks at risk, but we're not really, in this roadmap, not really addressing that issue.
I'll second that, Chris here. Some of the initial findings from our R4 our finding is, of course, built environment issues and so on that contribute, and that gets back to the larger system that cuts across all areas, socioeconomic and so on. So if we can try to be more explicit, including those sorts of things, that would be useful.
Okay. Well, I think We're ready? Still right on time?
We're 3 minutes behind, but we can catch up.
Okay. So goal 1 starts on page 19. And then we also had all of the projects were described a little bit more in Appendix B. So if you go back, Caroline, to the table. So it seemed like the bulk of ideas submitted were really around objective 1.1, which was conducting research to better define and understand and identify safe systems approaches. We had just a little bit talking about training and professional development. And then I think we had question marks about, you know, right now there's one project that Jennifer Woody is leading where she's working on integrating safe systems concepts into another initiative she has with a group of a network of public health providers. And so I think we had some questions about whether that project will be extended or if there might be other things under that objective area. But I think if we want to jump in, it seemed like the bulk of the conversation might be around those 7 or 8 project ideas that were under objective 1.1. So I think we just wanted to open it up. I don't know that we'll really have time to go through each idea in depth, but it, you know, for the folks who might have submitted ideas in this realm, and even the folks that didn't, if you have observations or follow-up comments on what you see here and what you think might be a priority for year 2, I think this is a good time to hear those thoughts.
This is Krista. I really liked 114, where we're developing the systematic safety-based architecture framework. I thought that was a higher priority. And then 116. So those are my ones I thought might want to be elevated.
Okay. And 114 and 5, those were aside, those were your part 1 and part 2 around a safe systems architecture and framework and then implementation tools. Do you want to talk a little bit more about that? Because I know we had questions too about how that might relate to some of the Quick Start projects.
Right. So I think that, you know, overall we need a kind of a framework for implementing, innovative solutions and also conventional solutions. So the idea of this architecture is to provide, some kind of a common language and also to systematically organize the crash modification factors that HSRC has hosted for so many years. So I think this is a great opportunity to connect those with specific maybe strategies and to ensure that we have safety practices that are implementable and we can do it in the field. So this is a mechanism by which we will have stakeholders involved, and also the functional elements of the system will be thought about. So, where is data coming from, where it's going, how it's being managed, all that, whether it's an intersection or roadway segments. Also physical systems like, looking at the built environment and vehicles and communication equipment that's coming on board. And, so to kind of thoughtfully provide a framework, a structure that cities and also maybe regions can use to implement safe systems approach. So that's the thought, basically. On the tools, which is 115, I was thinking of text mining, the studies that we are taking these countermeasures from, and also looking at case-based reasoning and expert systems type of tools and modeling and simulation as helping us more on the research side, but some of it is practice. Like, practitioners can be given more structured information, more organized information, and that will help them, especially when we are talking about innovative systems, safe systems. There aren't that many cases for implementation. So that's where we have to take the risk. But the risk can be calculated risks when we look at what other people have done in similar situations. So that's the idea.
Thank you, Assad. Are there questions either for Assad or thoughts from folks like Eric and I know Seth?
That's 3 minutes. I'm just trying to limit us.
Oh, okay. I thought somebody's phone was ringing.
Oh, I thought it was my dinner bell. Does this mean it's drinks hour?
Only for you, Steve.
In the airport, right?
I have
Yeah, unfortunately, it's 7:30 in the morning, so.
I'm wondering if Assad can tell us a little more about text mining and what I don't know about that, what that means in practice.
Okay, sure. So what people have done is more looked at how we can take, let's say, a document and do content analysis on it. But now we can look at words that appear together. So there is correlation between words, between concepts. And so there is far better tools to analyze what kind of content do studies have, and then to kind of, use it for meta-analysis, which is a technique also that's used widely. So these techniques are, at least in safety, for example, if we have 10 places where a certain countermeasure has been implemented, then the 10 studies could be analyzed, their effects could be worked out, whether the average effect is 10% reduction or 10% plus minus 5% reduction. So we try to get estimates of how much a countermeasure, or for that matter, a drug would work in the case of humans, in medical situations. So, that's the analogy that I would use, where we want to know what the effects are of these countermeasures, and text mining helps us figure it out from the studies that have been conducted. So it's a synthesis and a meta-analysis of those studies.
Thank you.
You're welcome.
I have a question or comment for 111. Caroline, do we have time?
Yep, go.
Okay. So I'm trying to see how this relates to the snapshot of specific safety issues, and my question is, under 111, is it more activities, or is it activity that would try to cover, would be across different types of crashes or type of safety concerns, or is this, or they're going to be specific, or it's going to be address specific concerns? And then the second part of this question is, there might also be value to separate the second part of 111, it's the part that talks more about considering how these systems will change with future demographic. So there might also be value to have activities that are specific to trying to project how these things might change in the longer term. Of course, in everything that we do, we're not trying to address things that are in the past, but kind of what it would mean for the future. But there might also be added value to explicitly have a task that tries to project how these systems will change, and or how to make. So when we're defining or thinking of these systems, how to make them forward compatible based on some projections or assumptions of how the population demographics or other things will change, and technology, of course.
Those are good questions, Offer. I think the first one, so the 111 is develop system maps for specific safety issues. I think the reason that went into the roadmap was because originally in the first Quick Start year, Steve, your group had proposed these bigger systems mapping ideas on a series of issues because the thinking was that every issue might have a different group of stakeholders and relationship structures that would need to be mapped out. And so what happened with that project was we focused on just one, but we didn't really get to dive into the issues. So Steve, do you want to speak to that question from Offer on whether these would be focused on a specific issue or separated out or just one?
Yeah, sure, I can speak to that. I mean, the quick start that I proposed was that there would be kind of a systems mapping, support service, so that anyone who was any of the quick start projects could have had support from systems mappers if they wanted it. So a systems map is just a big sketch or a diagram of how different components of a system fit together and interact with one another. That's, I think, was realistically a big activity that needed to be focused in year one, and I think it was wise to kind of put it into the Vision Zero component of CS project. But I think realistically for this to work, it has to be focused around a specific activity or a specific issue, and the most pressing one, or the one where there seems to be the biggest mileage, is probably the impact of technology on our roadway systems, and how will people use the technological gifts that are coming. Will they use them to increase the safety overall of their transit, or will they use them just to get places faster and cut other people off in line? And we know what people do. They're not very good individuals for the most part, and people always behave in a bad way. So I think there definitely needs to be a little more focus probably around 111, just to make it manageable and not have it become too open-ended. And it may be, there's all kinds of ideas, but certainly the safe states, or the what I call national peer, the CDC group that Jennifer's working with, this national peer learning team, is they've adopted that issue of the impact of technology and how it's actually going to play out on the ground, if you will, because a lot of public health people are very skeptical about how the technological impacts will actually be used, and what the transition period, the mixed fleet period, is going to look like in terms of when we have some vehicles that are connected and autonomous and other vehicles that are like our traditional vehicles. How is that actually going to play out? Does that evade your question sufficiently for the moment?
Yes, absolutely. And I'm hearing you say that you think technology is a big part, and when you talk about technology, you're kind of mostly talking about automated and connected vehicles.
Sorry, yeah, I should when I say technology, I should phrase it in terms of the transition towards connected autonomous driving systems. But there's a number of directions we go.
Yeah.
Sure.
I was just going to jump on that. I think that's a nice theme of framing it. It also brings in, I think, something that was listed separately but might come in here, including the role of shared mobility, sort of framing the technological advances beyond just connected and autonomous vehicles, and the frameworks that are in place would apply similarly to Uber, Lyft, and those types of
Oh, sorry, So I'm not sure that the demographic aspect of it is the most compelling, but I think the connected autonomous driving systems aspect of it, if that's what I think is meant by technology shift, that part is a very pressing topic that people in public health are currently trying to upskill themselves around the concepts of, you know, traditional highway safety concepts. So there's a real role for the center to play there if it wants to play it.
Thank you. This is very helpful. I'm trying out to see if 111 maybe because under goal 2, there's this last part of goal 2 that emerging road safety issues, and I'm not sure, or it's a question, should if indeed I'm understanding what you're talking about for 111, then it might also be, or it might also fall well under goal 2, because it does have the last part of emerging road safety issues. So it's more of a question of goal 1 and 2. Is one more about defining the principles and then sharing it, making sure that it's shared, understood, and adopted, and is goal 2 more research or data and tools and resources, as well as ways to address existing and emerging road safety issues. So I'm a bit confused on how to determine if it's under goal 1 or under goal 2 based on the discussion that we're having now.
Yeah, it's a great question. Sorry, I didn't mean it. Was David going to say something then?
I was going to chime in and say, I agree. I think it does fall under goal 2 more readily, only because it is more of a method and approach to study an emerging issue. I can totally see what Offer's saying.
It's not necessarily helping us to define a safe systems approach, but it's really to understand those emerging issues that we need to be thinking about in a safe systems approach.
Yeah, sort of getting ahead of that, right? Yeah, trying to anticipate what that might look like in that realm, in an emerging realm that we don't really know much about yet.
Especially if, as this project idea is evolving, it sounds like it is focusing more on the future technology and projecting some of the future issues. Yeah. Okay. So, Steve, I think one of the other ideas, going back to goal 1, objective 1, was this idea that you had put forward of the highway safety manual for public health. It was 116 is the numbering. Do you think that ties in to these system maps, or do you think that is truly a separate idea? I don't know if you could hear me. Steve, can you hear me? No, I don't think so. We'll come back. We'll come back to him.
So I will check on that one. I don't know what, maybe Steve can hear us soon. I'm not sure what he has in mind for that. That project is the one that scares me to death. Just knowing what all of us went through that were involved in the real highway safety manual for the engineering community. It only took 2 decades to get that done. And a hell of a lot of people throughout this country. So I'm not sure what he has in mind for that, but it can't be that kind of project. So
yeah, maybe it's the more into a safety textbook for public health.
Or like that mapping from the public health side, what these things mean from the highway safety side, how to translate that into public health.
The highway safety manual had a lot of research to try to pull it up for decades. Not as much.
yeah, only the NCHRP program essentially became the highway safety manual research program for more than a decade. And there were millions and millions and millions of dollars put into research to develop that. So, yeah, I think that's just one to be careful about what we're asking for there.
Well, maybe since Steve's jumped off, we can table that one for now anyways, because we'll need him to be more of that conversation. Going back up the list, one thing I wanted to point out was idea that's 113, examine a systems approach to improving post-crash care. That actually wasn't submitted by any researcher. It was an idea that came out of the advisory board. And so that's one that seemed to be an important idea. We hadn't really, none of the other ideas covered the post-crash issue. It was more about the pre-crash behavior or the countermeasure. So this is really the one idea out of dozens that dealt with post-crash care. So I was curious if anybody had a reaction to this one.
This is Noreen. I think I was certainly struck in that meeting by Dia's comments and the issues that she brought forth about the EMS system. So it seemed a whole if we don't have something that addresses post-crash, whether it's specifically a research project or something else. But I was happy to see that you included it in the list.
So in our data, R4 Quick Start, we're examining post-crash outcomes, linking data across the whole spectrum of health and hospital and EMS and so on with crash data. The thing that stands out here is examining systems approach to improving post-crash care. Kind of understanding is one thing, improving it is something that I'm wondering if there's people on this team that are good at that, that can really understand the mechanisms of the sort of post-crash care world. I imagine Steve might be, or others, but if you follow what I mean, the idea that we're not, some are public health professionals, but really understanding the improvement part is difficult, I think.
Mm-hmm. I thought the same thing as well, Chris. We might need to bring in more friends from the emergency medicine side of the school or partners that Steve and others may know. Folks at Berkeley, I know David Ragland has some background and past work in this area. Did you have a big sentiment about this idea?
Yeah, I'm sorry I'm late. I just logged on. I got delayed this morning in traffic, by the way. Related idea, right? Related topic. Anyway, a few years ago it was an expert witness panel that Booz Allen Hamilton sponsored along with NHTSA, and we prepared fairly extensive PowerPoint for that. By the way, there was a guy named Herb Garrison from North Carolina State or something like that, who was on the panel. I don't know if he's still around. But anyway, we've also looked at distance between crash and the nearest trauma center in California using just Google data based on the location of crashes and of trauma centers. And it turns out it varies all the way from 5 minutes in urban areas to 2.5 hours. And one thought would be to do a model, a statewide MS system to determine the optimal, what parameters you could change to reduce some of that time. Now that's actually calculated time based on mileage and not actual time. We're now trying to get some data so we can look at actual time. But what are ways to mitigate or to deal with this time differential? And one idea is telemedicine. There's a group at Berkeley that's working on telemedicine approaches to EMS response, whereby they are able to video and collect medical information at the scene, relay it back to the ER, and then in effect have the ER doctors on scene and virtually. Anyway, there's all sorts of interesting stuff going on in that arena.
Just as a time check, we're about halfway through this section of the objective 1 discussion, time-wise.
So looking at the projects there, I know there's a couple more in the list. Seth, did you want to talk about 1-1-7?
Oh, sure. Yeah. And let it be known that our UC Berkeley folks are implicated in this, even though we haven't really had any formal conversation about it. But the idea here is, behind this is really sort of inspired, I guess, by something that had come from the Berkeley Media Studies group based out there. They looked at the way traffic incidents, safety incidents, were framed in the media, and some very interesting findings there. Some interesting findings in general from the whole field of linguistics about how that seems to actually really influence the way people feel and think about any number of topics, including transportation safety. So it really occurred that sort of combining a positive deviance approach, really trying to understand those municipalities that are doing really great work and have found ways to actually improve their situation, how they are actually framing things and talking about transportation issues in town. And also using sort of a systems mapping approach. So really trying to get at the cultures, both inter-organizational culture, but also the culture at large through the media scan of how people are framing and talking about transportation safety, and getting at this construct of traffic safety culture. If there's a difference between those positive deviance cities and those that aren't doing so well safety-wise, trying to get a handle on the ecosystem that people live in, if it's systematically different across cities and stuff like that. So it was really trying to blend the sort of public health, looking at the cultural elements with really into the kind of safety issues that they're experiencing, sort of from a planning and engineering approach. So framing it that way.
This is Eric. I wanted to follow up with that. Going through a lot of the safe systems literature, I see a lot of discussion about safety culture, but most of the research that I've seen is at best underdeveloped.
Yes.
And I think getting involved in this area is a really good idea.
Well, I would agree with that, Eric.
Capturing that I haven't seen done well. It's largely conceptual. So this, I think, of a lot of the ones on here, is a pretty important one.
Yeah. Yeah, thank you. I agree with you. I think that's the thing. It hasn't been well defined, and this is sort of an approach, or at least an attempt to help define what that is, and does it actually seem to relate to better outcomes? If is this robust traffic safety culture, if it actually exists? What does it look like? That's what.
This is Jill. For the Office of Traffic Safety, we just finished a statewide survey asking about traffic safety culture, and we took some of the concepts that Nick Ward used in his national survey, and then we did a representative survey primarily via email, but then we also, and this was not representative, we were asking about marijuana because of Proposition 64, which recently passed in the last year passed in California, and then we in light of that, we interviewed or surveyed a subset of marijuana users and asked the general population and the specialized population about marijuana use, and found that, as you would suspect, marijuana users have much broader sense of safe traffic safety cultures. And I'm not suggesting that we go that specifically into traffic safety culture, but it might be interesting to think about, culture and subsets of culture as if we decide to pursue this objective.
Yes, that'd be fascinating.
I think we want to keep things moving, so we'll start looking at the second set of objectives that are under Goal 1. And we can always come back to the ones we talked about a little bit later. So 1.2 was about training and professional development, trying to share what we've learned about the safe systems approach with others. And so there was some talk about using HSRC's Road Safety Academy to help deliver some of that kind of definitions of safe systems through the training courses. Also, I know, Michael, you've talked a little bit about, leveraging connections we have to, talk a little bit more directly with the public or with decision makers about safe systems approaches. And then we've also got that bullet in there under 1, 2, 3 for Jennifer Woody. And Jennifer's not on the call. Okay. We might follow up with her directly on that. But just these ideas in general about how do we get the word on, or get, what we're learning about safe systems out through professional development or through these other organizations and institutions and networks that we might have access to, and then think about, starting to work with cities. And it seems like the ideas that came forward under 1.4 was really just, starting with identifying good candidate agencies, and several folks suggested that. So that seemed to be a pretty logical next step, focusing first at the cities and then maybe at the state level, maybe in future years. But did anybody want to, add your thinking on any of these ideas or what you think is most pressing for year 2?
Laura, I'll just pipe in about the, I guess, objective 1.3.1 or the proposed projects.
Mm-hmm.
It was something that related to when we spoke fairly recently with Jennifer Woody and her group at the CDC initiative. I think it became clear to several of us, speaking on our behalf, but that the way that public health, and I'm stereotyping, public health folks speak about safe systems and the way that planning and engineering folks speak about it is quite different. I'm wondering to what extent we'd want to privilege something like a 1.3.1 to develop this sort of common language just to begin with, because I don't know if we are speaking the same language at this point.
Yeah.
At the CDC, they even have, or there were 2 representatives on that phone call who were talking about how you frame this for different people in different silos and what's, oh, you were on that call too, sorry, Laura, but yeah, what specifically, you need to actually get over these hurdles between different practitioners.
And it seems like there's a need to have, not just one definition, but case studies and examples and context. And some of that will be coming out of year 1 research. That's my understanding, right?
I think so, hopefully.
And Laura, again, jumping back to the first goals, the 1.1.5, developing tools for supporting safe systems implementation.
Mm-hmm.
To me, that seems to be something that I think would really have value and be an important way to get the information organized in a format that's really usable.
Mm-hmm.
And I think that's I'm not sure the details that were intended for that, but to me that really resonates as important.
And Assad, you put forward the 1.1.5 idea. I think your use of the word tool was really more about the research tools you were employing, such as text mining and case-based reasoning. That wasn't necessarily a tool for a road safety practitioner to use, right?
No, it is a tool for road safety practitioners, Laura. I can send you examples of how this tool may look like, but my thought was that, planners and engineers should be able to go and access that information that they do currently at the website, Crash Modification Factors website. But here now they will have a far better structure to the studies, and we will take out the juice from those studies in a far more comprehensive way, in a more context-sensitive way that is we will describe the context in which those things have happened. And so, you know, the idea is to have practitioners use these counters. Am I making sense? Hopefully.
Yes, and your focus for that, Assad, was giving them more of a structure for using CMFs specifically?
Yeah, CMFs, and also just the knowledge that we have over time accumulated, whether it's using, you know, studies of, you know, text mining or you know, any of these other tools. Ultimately, what they produce is a more structured way of thinking about alternatives and how, you know, they may be able to implement the ones that are low-hanging or that are more compatible with each other or that address the problem much better together. So that's the basic idea.
Okay. Okay, so we haven't heard much from Michael so far. Did you want to weigh in on the one that's got Duke's thing there?
Which is that the 1.2.2?
Yeah.
Okay. Yes. Yeah, so this one was, if I remember the conversation, was this one, actually I don't remember, Laura, was this stemming from misinformation about the technology, or I'm trying to remember what?
I think it was that, and also thinking about like a legislative brown bag session and,
oh, sure.
and
yeah.
communicating some of the safe systems issues and even technology issues directly to elected officials.
Right, so for outreach, yeah. Mm-hmm. So this came from, I think, a talk that a panel that I was on up in DC back in September. Duke has a lot of inroads into reaching out to folks on Capitol Hill through their Duke and DC office, and we can arrange these lunchtime brown bag sessions to talk to some of those folks directly. And it's not necessarily, you know, the congressmen who are going to be coming into this, but it's going to be their staff. So if we wanted to reach out, if there was something in particular that we wanted to address, we could have a panel or a series of panels up there to do that sort of thing.
And does the public also get invited to those, or is it really
They're
staff?
Open. Yeah, okay. It's whoever they decide to send the invitations out to. Yeah. But we had for the last one, we had a pretty good turnout. The room, I think, fills about 80 people can come into it. And there's always an opportunity for follow-up. I had a couple of meetings after the fact as well, and you know, there's always a chance to go back to them again.
Mm-hmm.
Yeah.
Timing-wise, I was going to say, do you see that as something that could take off really quickly, or do you see it needing more time to come up with what?
I think if we had the material, we could set up very quickly. Yeah, if we had, I would say it's best to do these over lunch, like keep them fairly short, keep them to about an hour. But if we have an hour worth of material, I think we could do it, you know, within. I mean, I think a month would be doable with that much lead time.
Okay.
I think a lot of it also, we have to look at what is in session at that particular time. We'd want to time it right to make sure we got the most people and we could talk. I mean, you all may know that already, but we could also work with the Duke and DC office to do that. But yeah, we can do it on a fairly short timeline for sure.
Okay.
And Steve says he loves 1.2.2 in chat.
Steve approved.
Steve approved.
Good to know.
Laura, Asad here. I just wanted to mention that I think it's important that we start identifying cities that can be candidates for our safe systems approach. You know, there are cities that have shown, you know, proclivity to adopting innovations and new ideas. And like we were saying, you know, smart cities is one example. So smart cities, you know, they've received funding like Columbus, Ohio, and Tampa, Florida, and New York have received funding, and they are working on similar ideas, perhaps more on the intelligent transportation system side, but I think they may be open to adopting you know, some of the ideas that we are generating. So I think it's time. If we wait too long, it may, you know, things are changing fast. So we need to start on this immediately. That's my opinion. Over to you.
I think the only thing, Assad, you have to be careful with there is I don't think we want to go into those places, because then you're not going to be able to see the effects of the safe systems approach, because it's all going to get conflated with what's going on with all of the money they're investing. I mean, Columbus is an example of where they're investing $500 million into technology now there. And they're not sure what the effect of that's going to be. If you try to mix something else in there with that, I don't think we're going to have any way of knowing what was effective. I think our better option might be to look for cities that, I agree with your thought about we've got to find cities that are willing to take this on, or a state that's willing to take this on, but to look for those places that perhaps are willing, but they haven't invested a lot in either new programs, new approaches, that sort of thing. So you can truly see what the impact would be of changing the way that they currently do business. That's my only comment on that part.
Yeah, right, David. I agree with you. Although I think we should have maybe both type of cities. In this case, I was thinking more not at this entire, let's say, entire city level, but perhaps a corridor where we could test in Columbus, something that is unique, where we can identify the effect. So it will have to be designed carefully, but my thought was that we should include these cities in the mix, and maybe, as you are saying, other cities that have not been at the forefront of these smart cities initiatives, perhaps. Yeah, my thought was, and I agree with you overall that yes, I mean, they are putting $500 million, so they will probably have some effect. But if we are looking at the effect at, it depends on what level we are looking at the effect of, and if we have it at a specific enough level, then maybe we will find our safe systems approach effect. But overall, I agree with you.
I think the important part, though, is what you said is we do need to start identifying these locations, wherever they are, whatever the criteria may be. I think that's going to be a critical year 2 activity, is to start identifying these locations and reaching out and see who's interested and who can participate in this, and would be, part of the implementation piece then in the later years.
That's another one where, if you look in the appendix, we had a pretty long and growing list of potential cities. This is one where a lot of folks might be involved at different stages to help identify or reach out to potential communities. I don't have a good sense at this time of who might lead this project, but it sounds like it's definitely an opportunity for collaboration.
Yeah, perhaps one thing we could do is that those who are working with specific cities in any of their projects, we can kind of form a little task force and just talk through. Maybe there's some cities that are going to take the next logical step to maybe, and start implementing safe system approaches or something. I think we could get a good sense by knowing the cities a little bit.
Okay. Wow, that's the end of our hour for goal 1.
Laura, if there are still more comments about one, should we send them by email, or do we have a few more minutes now?
Yes, please do send them by email. You can use the chat pod now, and we'll record them in the chat pod if you want to, get them shared even more quickly. But yeah, I think this entire conversation is really just setting up the questions that we want to continue figuring out very quickly. So shifting our brains to goal 2, we realize there might be a little bit of overlap between goal 1 and goal 2, and some projects may actually be that were listed in goal 1 may really fit more in goal 2. The reverse may end up being true as well. We had I would say the majority of the ideas that came in were around goal 2.1, the objective of performing road safety research that explores a core safety issue and or a transformational change. So we had at least 12 ideas there. We had a couple that were kind of taking the next step into developing a specific resource or a data set that can be used by others. And then another one or two that were, helping develop more of a program or a countermeasure that could be implemented. And you can see we had no specific ideas put forward to actually disseminate any of the research products or findings. This is an issue that we could, we need to be thinking about. Maybe some of that comes out in year 3, but even in year 2, we need to be thinking about how do we disseminate the research that was produced in the year 1 quick starts. So I think people were probably wearing their research hats to begin with, but we need to start also thinking about the translation piece. But for now, let's keep, I think most of our conversation will be thinking through the priorities in that first cell, goal 2.1. And you can see I put brackets around a couple of ideas that kind of came together thematically. We had a set of 3, 2, 1, 3, 4, 5 that seemed to be kind of our planning block, where there was an idea looking at, how we can integrate safety into planning, or we can better understand the relationship between planning and safety outcomes. So I kind of grouped those. And then we had another block that was related to transit, either policies and how that might have affected mode shift, or how introduction of a rail might impact safety, how bus stop placement would affect safety, just the relationship between safety and transit. And I think we all agree that that's, those are important relationships, but I don't know that we'll be funding 3 transit projects in 1 year. So we need to be thinking about the timing and same thing with the other planning ones. Is there a sequence to these ideas? Is there overlap? I think maybe we can start with those questions and then revisit the other ones on this list.
So for 219, Seth and I proposed that one as far as looking at the fare-free modal shift. And I think that's something that we could possibly collaborate with our friends at FAU, since they were the ones who I believe proposed the other ideas. Really what both of these, or all of these projects are looking at is seismic mode shift and whether or not that has a large impact on safety. And so I think if we were to say look at going fare free or increasing bus ridership here, and they were to look at say light rail ridership there, that tackles 2 aspects of the problem. So it could be something that I think we could do collaborative with in maybe a single project.
Yeah, this is Eric, and I agree with that. I think that's a great idea. In terms of the light rail one of the motivating factors behind that is I wind up in a lot of discussions about that issue, and I know that there is interest, professional interest in information on that because it's largely absent. So packaging the 2 of these things together, I think, is a good idea, and it's going to hit an area where we're going to get a professional response.
And
Eric, can I ask you a question on that? Were you also thinking about the modal shift and the sort of exposure patterns, but also about some of the operational issues there with traffic, with transit vehicles and passenger vehicles in the same environment?
Both. So there was nothing, we didn't stratify by mode in any particular way. What we wanted to see was how the distribution of crashes differ after the introduction of these things. And I would expect there to be more incidents involving pedestrians because of the higher incidence of pedestrianism associated with it. But a big problem is these light rail cars running into vehicles. So getting a sense of what that problem is and what sort of design interventions ought to be put in on the design of these things is an area that I was looking to focus on with this.
And your Charlotte data that you collected, that would have before and after in it, right? Is that correct?
Yeah, we've got it for both Charlotte and Orlando now. We would be able to do a longitudinal studies on this to see what was the case beforehand and then what happened after the installation of the light rail line, and then compare the two.
I spoke to Tab yesterday, and she was talking about Durham is about to change a lot of their bus patterns, and so there may be opportunity too for if we could kind of do some of this research quickly, at least gather some before data for Durham, and then see how things change soon. And so we were actually maybe going to mention this to Michael too, as far as how that would impact everything.
The spatial scale is really important for looking at these patterns, because I think they're already on to that, but.
Chris Cherry here. Let me just interject real quick. We hired a new faculty member in September who focuses on transit operations and so on, and looking at mode shift and technology and several other things. So I wanted to mention that because at UT we have someone now who's quite well versed in transit from an engineering and IT sort of information technology perspective that may be able to contribute to the more planning side of shifts in transit. So if it comes down to networks and mode shift and other things. Similarly, she's looking at how shared mobility and TNCs are kind of impacting shifts in ridership, which is an interesting question as to whether that would ultimately make things better or worse for safety for all road users. So substitution between transit and Uber, for example.
Yeah, put that out there. And yeah, we would very much like her involvement in the project, the transit side.
This might be an opportunity to engage with some of our other cities that we've been working with as well, because we've been looking at it from the pedestrian safety side and seeing this relationship to transit activity and increasing pedestrian crashes. So I don't know that we have before or after data, but this might be an opportunity to engage with them and look into these questions and potentially find out if we can study the design aspects in more depth. So while it does look like 3 different transit projects, maybe it's 2 projects, the mode shift and then the who's impacted and at what scale they're impacted and how and what is actually going on, because while we have theories about what's going on at transit stops, we don't really know all the potential contributing factors.
So one is the mode shift of new transit being introduced.
Seems like.
And then another is the operational and design impacts on safety.
And yes, and who is affected differentially, because you might have system-wide decreases in crashes relating to mode shift, but then you have spot increases relating to pedestrians and access.
Right.
Things like that.
Bus ridership or pedestrian traffic.
And then going back to the policy piece, the going fare free, were you?
She's fired.
Do you see a lot of communities going fare free? Is that a common policy that?
That was an older policy in Chapel Hill.
2002 they did, yeah. It was a thought that there was a sort of seismic change, systemic, right? It was pretty immediate, and it affected ridership pretty significantly in a very abrupt way. So what exactly happened at that time in terms of safety?
Krista's looked at, or she mentioned a couple different communities in the mountains where they may have a single bus that people can ride on or a single line, but probably not to the degree that we have here at Chapel Hill.
So
I want to make a quick broad observation about some of this, because it just goes back to something that Steve said at the very beginning of the call. When I look at 213, 214, and 215, you're talking about different I'm looking at them basically in terms of the data that feed into safety. And we had a very similar relationship with 1-1-1. And I'm just thinking, going back to what Steve was saying, if we're looking at these in terms of like maps of what the different effects are, it seems like we should be thinking also about if we design a map in one area or another one for these three, could those eventually be fit together into one global map that fits, in general as a larger research project? So not necessarily assign a number to it, but in each one of these where there's a data element, where there's a mapping element, see if we can start to fit those together into something broader and see if we can look at relationships between them. So if you look at some of these, looking at, is there a relationship between, population density and alcohol use, and see how those things fit together. Just something to keep in mind and to see if maybe they would integrate a little bit. So if you do a mapping for one, maybe start to build a larger, poster size map for all this stuff.
Yeah, I think that mapping exercise would be an important maybe component of every project. It's getting it started, just thinking through this framework and how the pieces fit together to make sure we are really looking at it at a systems level.
And whichever ones have a data component, we could eventually actually build a model and look at those relationships, see if there's a way to quantify some of those relationships.
And that ties in very closely with what Rod McClure was suggesting in the call that we were all in. So if we have this kind of conceptual model of an issue, and we know that this piece affects this piece, affects this piece, affects safety, if we can start to define those relationships, the transit effect on this or the planning land use effect, then we understand the impact of the different levers in that model.
And then also tie it back to the project that Assad was presenting before. If you do the text dive within different journal articles or whatever, and you see more of those relationships come up, that may actually drive some of that data as well. So I mean, this could really affect a lot of nodes within the roadmap, I think.
Asad here, thank you. I just wanted to mention, I think the land use connection is really important. So would be good to invest in that area. In my while I was at Chapel Hill, I did a study with Daniel Rodriguez, and basically we ended up surveying neo-traditional community as well as conventional community, and we compared their travel patterns and mobility and health outcomes, but we did not really focus on safety. And the idea now is that maybe in a separate study with Bob Schneider, I looked at safety on campus, but perhaps these ideas I thought could be merged nicely, such that we do a survey of neo-traditional developments that are high density, mixed use, and pet bike friendly and transit friendly, and then to do another conventional a comparison with conventional neighborhoods, and see which ones safer, where are people engaging in more safe behaviors, and how do we understand the connection between safety and land use, but also the travel patterns and how they are different, and do they exercise within the neighborhood or outside the neighborhood, and do they walk more, and if so, are they more exposed to more dangerous locations if they are in neo-traditional versus non-neo-traditional. So those are some of the ideas that are kind of went into at least my thought on suggesting something here. Over to you.
Yeah, and I think 213 and 214, I think we're both pursuing something very similar, and that might be another opportunity to partner up. And you go through the safe systems literature, and one of the common themes is a critique of what we do is focusing too much on the at-the-scene actors, so what the driver did immediately before the crash or what the pedestrian did, and we don't shed light on the downstream factors, a lot of the planning, design decisions that essentially loaded the gun to create that situation to happen. And these two, the ones here, I think do a very good job at getting at that issue, which is how do we start shedding light on these decisions that are made without respect to safety, but which have a profound impact on safety later on down the line, to create the condition where the error will occur that causes the injury or death.
Eric, and following up on that, I think also 211 with the focus on speed has obviously an opportunity to focus in there, particularly if it's looking at some of the upstream design issues, which I think some of the sub proposals in that did. One thought I also had is that there's an obvious connection here with some of the implementation science, particularly maybe on the speed issues. So what's the implementation science analysis from goal 1 of why safe systems approaches may or may not be implemented, and some of the design-based approaches to modify speed are a case in point where, you know, some of the solutions are well known, but they may not be as readily adopted in an American context. So maybe some of the speed research projects here would also be incorporating some elements related to goal 1.
Yeah, I think that's right.
I have two things. So one more thought, a few suggestions or comments about speed, and I think that there's also room when we're thinking about speed to also project forward how things can look in a more connected, automated environment, and there might be opportunities to also make speed something that, or speed limit that can change with the environment or with the time of day. Because right now, for the most part, the speed limit is, so it's the same speed limit, I think, for in most states or in most places, daytime and nighttime, because it's very difficult for humans or for drivers to ask them to, oh, when it's nighttime, drive a little bit more slowly, because it's much easier to have a certain level of driving velocity. But then there are some locations that are not well lit, and then you expect human drivers to slow down in these conditions, but it's very difficult to get this message across and to enforce it. And forward with technology, there would be opportunities for policymakers also to add these requirements if it's not a well-lit street. So the speed limit might actually change, and an automated vehicle would be able to do that on the spot. So also thinking forward, there might be other additional layers that we can put on top of the speed bump that can the technology would give us an opportunity to do. And that's one comment more about the speed. And then there's something else that didn't suggest before, didn't think about it before, but looking at 2.1.8, thinking about the placement of bus stops, there's for shared mobility, so the pickup and the drop-off points are user-entered, and there might also be value for research to think a little bit more, or to study a little bit more what that means, and to see if based on that there can be some policies or guidelines that are put forward on what would be more safer or more appropriate pickup and drop-off points, because right now it's pretty much user-entered.
Texas had a night speed limit until about 5 years ago, and then they got rid of it.
Do you know why they got rid of it?
Yeah, they wanted to go to 85 miles an hour.
It was you know, with respect to speed, David, some of you, maybe at least me, remembers the 55-mile-an-hour speed limit, and in the 70s, and there was a lot of pushback, a lot, including Popular Agar did a lot, and that. But so there's also a cultural kind of dimension to this, that speed may be more related to the design. I mean, as you guys are saying, and rather than speed limits, posted speed limits. When I drove in today, 20 miles from the suburbs to here, I don't think I saw anybody obeying the speed limit. And it had more to do with how fast people thought they could go, I think, based on the traffic and the design. So I don't know. That's kind of a thought or dimension on this. We've had a cultural change in alcohol, DUI, and in seatbelts, but we haven't even touched speed. And I don't know why that's been the case. But there's something, about speed that we haven't been able to do that we've been able to do with DUI and also with seatbelt use.
That's my.
Maybe there's a study there somewhere.
Sorry, this is Libby. That's my primary interest, David, as well. I think it's how time is money, as we say in this country. And I think that we really need some research into some of these perceptual issues, and perhaps some of them can be debunked about how much time is saved by speeding. And somebody I saw raise the idea of fleets and delivery vehicles, is speeding increasing in relation to those? And, trips are changing, trip patterns and so forth are changing to a large extent. So it's just a whole realm of questions. It's just which are most important and which can we get an angle on, and the data and an approach to study these questions. So I'm interested in talking to others that are interested in the idea, talking further about those.
Libby, was it you and Bo that had worked on a taxonomy of speed-related crashes?
Yeah. But that was a little bit before Bo joined us, but I saw, somebody put in this idea, but we've actually developed 2 speeding-related taxonomies here at HSRC. So one was done when Forrest was here with mostly roadway data and using FARS and GES data to look at common crash patterns associated with speeding. And then a few years after that, we took another look using the National Motor Vehicle Crash Causation database. And that database included on-scene investigations and interviews with drivers and witnesses and so on. And they did document a lot of information on the driver's mistakes, perceptual and otherwise, and what happened in the moments leading up to the crash. So that report is sitting somewhere in NHTSA's office. But we have some groundwork on these kinds of questions that you raised about what the kinds of errors just prior to the crash, and all kinds of other data relating to that. But
right. Libby, I think Asad here, I think that, we have a very rich set of data now that has become available, like the NDS data as well as the, second by second, or actually 1/10 of a second data on speed. So I thought that one could revisit that, because such data was not available before when the studies that you mentioned were done. Perhaps maybe it will give us new insights and looking at it and developing some kind of a taxonomy, as well as just looking at it from a volatility perspective, which was what I was looking at also, kind of looking at how we can reduce the volatility of driving where we don't have too much hard acceleration, too much hard braking, sharp turns, and so on. So that perhaps could add another dimension to this taxonomy of speeding and speed-related crashes. So it was kind of looking at normal behavior as well as non-normal behavior, and seeing, how we could come up or refine the taxonomy that we've had so far. That's just the idea.
Mm-hmm.
And I would add, too, one of the very interesting things Ostroad has done with their safe systems approach is they're going through and they're looking over, they essentially categorize all environments by what their appropriate speed is for that context, and then they identify the outliers on both ends. So those places where, speeds and low speed environment speeds are higher than they should be, but also environments where high speeds are okay, but the posted are lower, and then addressing those. And it's a nice balanced approach that tries to put speed, not in terms of the context of we're going to shut all drivers down, but instead there's going to be a rationale for speed limits based on what the appropriate operating behavior is in this environment. So they're able to position this as sort of a win-win situation where there's a rationalization about why the speed limits are what they are and why the corresponding design interventions are what they are. And it also helps pilot where enforcement would be most effective. I thought the way they did it was really rather clever, and it would be nice to see that kind of idea start circulating in this context.
So I'm sorry, I missed the first part. What?
We might have to continue the speed conversation offline because we are starting to get a little bit more behind on what we wanted to cover. So what Caroline is showing now is a few more of the ideas that were still under that, fundamental research objective. Noreen had brought up this issue that urban freight is one of those emerging issues as there's a lot of new delivery services and technologies changing. And this may be an understudied issue, particularly, as she pointed out, in urban issues. Noreen, did you want to speak a little bit more about that?
Yeah, just to, this came about because one of the state highway folks I was talking to was actually saying that an AASHTO freight committee of state DOT folks brought this up as one of their major issues, how safety is evolving, right? As presumably, if we go to a society that relies less on us driving to get everywhere, we're going to have ever more freight delivery. And we already see the droids operating in certainly in some European contexts and American contexts as well. And even our standard UPS and freight. So I think as the earlier diagrams pointed out, it's a relatively small share now, but it's one that I think we anticipate increasing, and because it's heavily driven by technology and all our changing ordering patterns. And I think there's really very little out there on what safe systems means for urban freight, and planners have certainly been guilty of really not accommodating. So this has a lot of worker safety issues, as well as thinking about vulnerable road users who may be at risk due to delivery vehicles.
Mm-hmm. I think parking in bike lanes is a common practice, treating bike lanes as delivery zones.
That's what they are.
I thought, this is Krista, I thought it would be interesting to include in that looking at cities that have reduced their delivery vehicles. I've heard Paris has done that, and see if that has an impact on safety and in terms of like restricting the size of the vehicles that can go in the city center. I'm not sure what New York is doing, New York City, but I think they're up to something. And there's an interest by NACTO on curbside management, and it seems like that topic may be related, and so there may be some ability to work with a group of cities through NACTO.
ITE also had this as a pretty big issue in the program that they had in Toronto recently. So the next one on the list is, any other comments or reaction to that topic?
Let me just jump in one real quick. I deferred this comment from the earlier slides with the pie charts and the injured road users and so on. I think, what is it, 4% of road users are fatalities are from freight vehicle drivers or occupants of trucks or van buses. So I just think that we need to be careful not to look at that and say it's not a problem, because obviously they contribute to safety issues throughout the urban area, even if they're not killed when they run into someone. So as vehicles become more diverse and smaller, maybe they may mimic, they may not be 18-wheelers, hopefully not going through urban cores as much. So I think that's an important piece.
A few years ago, the director of, I think it was the Long Beach Port, gave a presentation on how they, because their facility, I think, was like right in a neighborhood, basically, and that might be a place to look for some data ideas.
Now, goal 2, since it says it's about existing and emerging road safety issues. I mean, I know at least on the pedestrian side, we suspect that driver and pedestrian distraction is one possible reason why the pedestrian fatalities are going up so dramatically. I mean, it's just they've been going down for the last 2 decades, and then all of a sudden, in the last 2 or 3 years, they just start going crazy in the other direction. So, I'm not really seeing much here in the way of at least trying to address that issue, or what are the causes of increasing fatalities? And is distraction, or is it some other things going on?
Yeah, we didn't have any specific projects looking at distraction or the systems approach to thinking about that issue.
Yeah, I know NIST is trying to look into it a little bit, but I'm not sure they're really going to be able to, resolve specific causes, or at least countermeasures.
So much of it comes back to the issue of measuring the problem.
Yeah,
It's
hard to measure for one thing.
They did do a study looking at the impact of electronic devices specifically on pedestrian.
VHB is doing that study, right?
Yeah, VHB is doing that study on vehicle and pedestrian distraction, specifically cell phones. So.
Yeah. I keep trying to find out more about that study and what they're finding, what they're doing, but depending on the scope of that study, I'm just wondering if the UTC study should at least try to get into that a little bit too.
What came out of that there might be more to explore. Because there definitely is.
Is it getting into countermeasures?
Yeah, I don't remember exactly how far they took. I think they just assessed the problem and then came up with some conclusions. I don't know how far they came with next steps other than the analysis of the
I know
data.
they did a lit review or something,
Yeah.
but I'm not sure. Okay.
I mean, I can get you in touch with who did it. And so hopefully.
And Laura, I don't know if you can add any new ideas to the mix, but to me, that's a huge issue for pedestrians, not only the driver, but for pedestrians being distracted.
So Duke right now is doing a countermeasure study on distracted pedestrians. So if the mobile device, if they're distracted by a mobile device, if it had some kind of a sensor and that could detect an oncoming vehicle and it warn the pedestrian, would the pedestrian be able to rely on it, essentially? So if you were repeatedly getting warnings from your device, at what point would you stop trusting it? Would you continue to trust it if you were getting these all the time as a pedestrian? So it's a small piece. That's what we're looking into.
Yeah, just, one obvious solution is if all cell phones could have a device that when they're in a vehicle, maybe driving, I don't know how you can distinguish between driver and passenger, then the phone shuts off and it's not operational or something, where it sends a message to the caller, can't respond, in the process of driving or something. But I mean, that's one idea that's been put up there.
So going back to some of the ideas on the board, the dive, the simulator that you guys have, is that a tool you see plugging into any of these other research ideas, or do you see that as you have other standalone ideas for?
No, actually, I think on that one specifically, we would need someone else to help direct what that would look like. Now, I didn't see any specifically on the ones that were already mentioned, but so basically for those who haven't seen it, the dive, that's the Duke Immersive Virtual Environment. It's a 12-foot square room that's a fully immersive virtual environment. And I know that the folks, it's run out of the mechanical engineering department in Duke's engineering school. And I know the folks who work in there are always looking for new projects. So if there was a way that we could integrate some kind of a vulnerable road user simulation within there and do some kind of testing, if there was something that's too dangerous to test on the road or something we could examine empirically in a virtual environment, we would be very open to partnering with the group that does that. So we don't have a specific idea, only in the sense that we would like to do something with vulnerable road users. But then going from there, if there's something that we could examine, we'd be happy to look into it and work with the folks who operate the dive.
Noreen, that might also be something we could pose to students and try to engage more of the students in that work.
Yeah, definitely.
And so, Michael, if we have specific ideas, so just to shoot you an email about it.
Yeah, that would be great. And then, so I'll have a conversation with the folks who run the dive and just mention that this might be coming as another conversation that we need to have.
Just a quick note about that.
One aspect, Asad here, one aspect of this is the truck-car collisions, and I think, you know, truck pedestrian could be interesting as well, but truck-car collisions have been traditionally very severe, and, you know, I think would be also a freight issue that we might want to visit in future years, not right now, but just a thought.
I was just going to say, Michael, one thought about that, just kind of put it out there. We had a couple years ago at TRV a workshop on distracted walking. And one of the things that came up and was concluded is that a lot of virtual reality studies on this subject have been very artificial in terms of kind of giving people tasks to do on the phone.
Right.
And one of the cognitive psychologists there had done really good field work talking about how people are more likely to respond to something if it's a significant other, a friend of theirs versus somebody they barely know. So maybe even incorporating some real life elements into something like that, where they're more likely to respond, to be more realistic in those environments.
Yeah, that's a great idea. I mean, that's something that I ran into when designing the experiment that we're doing right now for the distracted road users, and I ran into that same problem. So that's pretty helpful.
Good for getting baseline data.
Yeah, right.
Yeah, that's right.
Anything else on that? We are definitely getting short on time. Anything else that stood out on this list of ideas, or that folks who put them forward want to, add to what's there?
Just one thing, Krista may want to touch on this, but I think it's 2-2-1, the Central Data Clearinghouse. That's something Seth's been exploring with the intercity pooled fund idea as well. So there are several avenues that are looking at that right now.
That might be an opportunity to collaborate with Renzi, right? The idea?
Yeah, we might delve into the big data world.
We've briefly introduced the idea to a few different cities now who seem interested. Seattle yesterday expressed some interest. I think Charlotte expressed interest. Who else did you say, Seth?
I don't know, Libby spoke with.
San Francisco.
Just to add to that, we're currently doing a project for Caltrans to develop a repository for pet bike count data, as well as land use based variables or other explanatory variables that can be used for modeling pet and bike, so that so it's a repository for counts done in California, mostly on the state highway system, but we will already have the information that you need to apply a model or a direct demand model for pets and bikes. So that there might also be some room for collaboration there.
I think so.
Yeah, Laura, just one idea that 2.2.2 did develop risk index prediction for pet bike crashes based on infrastructure. I mean, that almost sounds exactly like the NCHRP study developing safety performance functions that we bid on, and a lot of other people did. We did not win it, but I think that's sort of ongoing as we speak. Is incorporating, I think, land use variables potentially in infrastructure. So that study is ongoing.
And also relates to 1773.
It's actually the conversation where that idea came out of was Libby, Krista, and I were talking one day, and Krista's done a lot of work related to risk assessment. So we were looking at 1773 and the risk, trying to conceptualize risk as far as pedestrian collisions go. That's where that idea came from.
An interesting thing I noted, because we were following up, we raised the idea of the level of service measures and these other kinds of indices, and now we're starting to see, oh my goodness, the same variables really are related to crashes that people had been posing as related to comfort and perceptual measures. And maybe now we can help draw those connections.
Yeah, I agree. Thanks, Wes. It's a follow-on to 1773. Thanks. And thanks, Libby.
Okay, so goal, the objective 2-3 is a project idea. This was related but still separate from the Quick Start project on teen drivers. This was also the only other kind of, I guess you could say, multifaceted, community-based effort out of the project ideas that came through for teen drivers. Do you want to add anything to that and kind of the timeliness?
Sure. Is Natalie on the phone? Because this is really her baby. So.
Don't think so.
So, yeah, basically in a nutshell, an approach that we know would work to improve teen driver safety is if we could get teens in safer vehicles. Because teens now they tend to drive the oldest vehicle in the family, old clunkers, ones that are the least likely to have important safety features like front and curtain airbags and anti-lock brakes and things like that. So this is, as Laura mentioned, it's a community-based program to try to change the norms in one community to focus on safety first when choosing a vehicle for teens. The safest vehicle the family can afford, whether it's a used vehicle or if they can afford something new. So we'll be working really closely with schools and driver ed and auto dealerships. There are materials out there available for families, like recommended vehicles from the Insurance Institute for Highway Safety. So making sure that teens are driving these teen-approved cars. So this particular project, we know that the crashes among teens are very hard to prevent because teens are inexperienced and there's so many different causes to the crashes. But if we could get every teen in a safer vehicle, just like seatbelts, we know that that's going to reduce injuries and save lives. So this is a project that's being funded by the Insurance Institute for Highway Safety that's slated to begin in early 2018. So we do have matching funds available for this project if it ends up getting selected. So.
Something I sometimes wonder is why do we stop with teens? Why don't we just encourage everybody to get in a safer vehicle? It's a good starting point, absolutely.
So one of the 3 or 4 pillars of the Safe Systems approach is trying to get everybody in the safest vehicle possible. Teens, more so than any other drivers, are in particularly unsafe vehicles.
People know they're going to crash. So.
They have higher crash rates, yet we put them in the most dangerous vehicles.
It's the old hand-me-down problem, right?
And is that measured after the fact of a crash, though, or are you looking at crash rates by vehicle characteristics? How are you measuring it?
How are we measuring?
Yeah.
Well, we're going to be, this particular study will be looking at, there's going to be a comparison we're looking at vehicles that are being driven by teens in the 2 different communities before and after the program through observations of the vehicles and television. It's hard to just use their awareness of what's going on in the community and to get more in depth about the kinds of vehicles teens are driving.
Now, what I'm asking is how is the safety of the vehicles determined? Is it based on their frequency of getting involved in crashes or the outcomes, or a mix of both? The outcomes if they get into a crash. For example, a slower, older vehicle might get into fewer crashes, perhaps, but maybe the outcome is worse if they do get into a crash. How is the safety of the vehicle being assessed? Performance, is it?
So I think we're looking at it in terms of the features that are available on the vehicle. Simply because I think it's too hard to try to get into the measurement issues that you're raising. I mean, it's, you know, a teen might be driving an old clunker, but if it's a big vehicle that isn't overpowered, it's possible that actually could be safe in some respect for a teen driver. But it just, there's so many differences between models.
Oh, that's, yeah.
Chris Cherry here. Can I interject? With our Complete Picture project, we are exploring this idea of looking at crash data because much of the crash data has make, model, year of different vehicles, sometimes VIN that you can connect to DMV, which looks at all sorts of interesting pieces of information. At any rate, one of the things that we were interested in is comparing crash severities among different types of cars, controlling for everything else that we can control for. It might be a way to validate IIHS ratings and see if indeed of cars that crash are the ones with higher ratings experiencing fewer severity, lower severity, and so on. So that's something we've talked about. It's not necessarily a project we're after right now, but it's certainly something we've explored with the data. You know, when you're exploring data, you see these things pop out at you, and so that I think with crash data, you could look at teens and what kind of vehicles they're driving and which vehicles are actually producing lower injury severity, controlling again for speed and everything else of the crash. So
there was a paper published.
Hey. I was going to give 2 comments for you that you sent over the web. Is that what you're doing too? I think so. So Steve says that he.
I was.
Go.
Steve's back from the bar.
Yeah.
All right.
I was just going to say that I think it gets a little hard to hear when the people in the room are just talking to one another. The volume's kind of soft. Well, that was my only comment. Bye.
Sorry.
Right, you can go back to the bar now.
I think one of my concerns about this project, I mean, as someone who just bought a new car for a teenager, I obviously think it's a great project, but I worry about the equity concerns here and what is the potential of this project to actually increase disparities across social classes in teen driving crash rates. So if we reduce the overall risk, but we increase the disparity in risk, is that a good outcome? You know, as an epidemiologist, I think it's good if the average risk goes down, but from an overall systems safety perspective, if we increase the disparity in crash risk across social class, is that a good outcome? So I don't have the answer to that, Arthur. I just think that I have to see something in this project that reassures me that it won't increase social disparities. Do you understand what I'm saying?
I do. I think you raise a good point. I think the goal is to try to encourage families to put teens in the safest vehicle that they can afford. And the Insurance Institute that I mentioned before, they have recommendations in different price ranges. So if you can only afford a car that's, you know, $3,000 to $5,000, they have recommendations in that range. If you can afford something more, then they have other recommendations. So it's now I get where you're coming with the social disparity issue, but I think the overarching goal is just whatever the family can afford, make sure that it's as safe as possible.
And so the phrasing of that for those families has the potential to be kind of awkward. It's sort of like telling them, this is the risk that goes with your social class. And I worry that we're sending a reinforcing message in a behavioral context about what is acceptable risk and why should that be differential across economic. Anyway, I understand that that's the way the information is presented. I'm just not sure I want to endorse that way of presenting the information.
We've got to stop here because we have 3 minutes left, and there's actually a lot of important stuff on this last slide to cover. So I think all of these ideas that we're talking about, this is, we're still in this process. And so having these conversations now rather than after the projects are already written up in a few more weeks is very, very helpful. And so as you can see on this list, one of our next steps is to keep having small group calls, conversations, one-on-one calls to really follow up with some of what was shared today about the priorities, about the concerns, and see what we can be moving to the next stage. And that next stage is there by November 17th. We have to be submitting these 2-page write-ups with a budget assigned to them as well, and get those circulated for review. Just before that, something we haven't talked about is actually something that we did talk about back in August, which is how we're going to always ensure that this process has opportunity for peer review and comment, because that is something that was built into our proposal and expected by USDOT, that these projects are vetted. And so we are trying to build up that pool of potential reviewers. We talked about, and I think where we left it when we had the retreat in August is that now up until November 3rd would be a good time to identify people with content expertise. Now that you've seen the ideas that are there, you have some sense of what might be moving forward. If you could be thinking about potential people from local government, from other universities, from our stakeholder group, from our advisory board, anybody that comes to mind that you want to start putting forward, we're going to be developing a pool of reviewers external to the CSCRS. Once we get those 2-pagers in November, we're going to very quickly turn those around to some folks to get input, mostly on the technical side. We're not asking for them to score this project and say yes or no. We're circulating this so that you can get additional ideas on, how to strengthen the project, how to think about the data source or the methodology or the final product. And that way you'll have a little bit more input as you develop your work. So that process will be happening, and we'll be getting that feedback by December 5th. We will be tapping the associate directors to also be reviewing write-ups for the projects that they're not leading. And then we hope to continue getting a little bit of back and forth thinking about the budgets and the financial issues during that same window. And then we are still aiming for a December 15th date when we can give approval for the projects to start. This is leveraging the time that David is still here. It's also, because we realize we've heard from a lot of you guys on the phone that you need this information in order to know which students you're funding in the next semester. We are trying to have a very timely turnaround, but it feels very fast, and a lot's going to happen between now and November 17th. So are there questions about this? Any other comments for the good of the order in our -1 minute left?
Is this slide going to be made available? Can you email out this, or did you already email out this PowerPoint to us?
We will mail out the PowerPoint. We also recorded the call. We will share the archive as well as our notes from this meeting in the chat box so that everybody who might not have been able to make the whole call can still access it.
Laura, this is Krista. Who's writing the 2-page project descriptions that are due by November 17th?
That's up to the folks in this room, and that's going to also be an outcome of those small group conversations. We're going to give some pretty firm guidance, I think, on the projects that we know we don't want to keep moving forward. But the ones where you all have identified synergy, where you know that there's a match potential, where you feel like it's incredibly timely to be doing this in year 2, we're going to be having follow-up conversations, even as soon as this week, to make sure those are moving forward. Is that process clear to everybody?
Yeah, one of the things that I would add to what Laura said, on one of her early slides, she mentioned this issue of, what we're trying to do now is trying to figure out what the priorities are really for year 2 and what we want to fund in year 2. So as you kind of go back and you've heard the conversation today and you begin thinking about the various projects, think about the projects that definitely in your mind are year 2 versus year 3 versus year 4 sorts of projects. I try to start thinking about really sticking projects and ideas into a roadmap. Where do they belong along the road? So I think that helps to try and think that way, because there's a lot of great ideas, but we know we can't fund them all in year 2. And so there may be ideas that just have to get pushed out a year or 2 years. So,
And HSRC and UNC is probably going to have a very quick follow-up, because so many of these ideas are coming from HSRC. We need to be talking about the big picture, given HSRC's specific budget. And I know every university is going to be having that conversation. What is their budget for research and education and professional development, and how much, of the ideas that they've been talking about, what do they feel is the best fit for their resources in year 2?
Hey, this is Steve. Can I just say one thing?
Go ahead.
I know there's a lot of conversation about whether such and such a project is goal 1 or goal 2, but I think the most compelling projects are projects that would have a goal 1 aim and a goal 2 aim. So you can do a single project and move ahead on both goal 1 and goal 2. Just something to keep in mind.
Great point. Thank you.
And then one thing I would add here that would be helpful there, I know there was some confusion about this last time as we're working through budget, is what sort of outreach projects are we going to fund? If we want to partner with local agencies, for example, to start promoting this idea of safe systems, do we want to start committing budgets to that activity? I mean, that's the 2.4, I guess it was, that there was nothing under. I mean, part of my reservation was for proposing those is not being sure what you guys want to do. So maybe some guidance on that would help.
Guidance on 2.4 in particular? Okay.
Now, I think it was objective 2.4. It was at the very end. It was like outreach and dissemination to practitioners.
Yeah, you're right. That was definitely a gap, and we can be thinking about that as well. We did it. Mission accomplished.
Yeah.
Well, we're also interested in your feedback on this call today, because we're going to be doing it again on November 8th for the last goal. And if you have thoughts on what might be helpful to prepare or do differently for that one, we are all ears. And thank you so much for your time today.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you.